Hi guys, how are you all? I hope you're all doing wonderful. Today I finally had a little bit of free time to sit down and record for you this video covering some of the topics from Diploma of Enrolled Nursing at TAFE, and this is just going to be my own experience of being a full-time student at TAFE. So basically what I wanted to talk about in this video is your semester 2 and your semester 3, which is your final 2 semesters. The whole Diploma of Nursing takes about 18 months. This is for full-time studies, and during this 18 months you will be required to attend your campus roughly 3 days a week. Fourth one will be your individual home learning. So during these 3 days, I had first day was a completely full day, which is starting in the morning and finishing about 4 to 5 p.m. Second day was a little bit shorter. I think we had it since the morning till about 3 or 4, and then third one was a little bit shorter again, starting in the morning and finishing roughly about 2 to 3 o'clock. So again, this will differ from timetable to timetable and from campus to campus as well. Also, if they decide to do some changes for the new year students, that may impact that as well. Okay, so I will start by talking about units that you will be covering during these 2 semesters. So basically your amount of units for both semesters will be very similar to your first semester. If you haven't seen the video where I filmed about information about first semester and your first placement, I'll leave the link in the description box below so you could have a look at that video. So pretty much in these 2 semesters you will have roughly about 8 to 9 different subjects. Each subject will have about 1 or 2 assessments. I should say most of your subjects will have about 2 assessments. Those ones that would have 1 assessment is going to have quite big assessment. The other ones that have 2 assessments will have 1 smaller one and 1 bigger one. Okay, then you will have some lab tests. That's the tests, practical tests that you will be performing in labs due to your placement, and you will have your main exam, which is OSCA exam, and you will have your medication calculation exam. And you may have few online quizzes as well. So I will briefly talk about each one of them now so you can understand what they are. So basically, assessments. I would recommend for you to start your assessments as soon as possible. Once you get the access to the assessment, open it, go through it and see what information you need to be looking for, what the requirements are and stuff like that. Why I would advise you to start earlier is that because you will have during your semester some of the assessments either due at the same time, and I'm talking now about 2 different subjects, let's say, so they may be due at the same time, or the difference between the due dates may be just a few days or a week. So you technically will be working like on 2 assessments at the same time. So this is why it's really important to start it earlier. Do not wait until your teacher completely covers the whole unit in a class and then you think, oh okay, now I know things and I'm going to start answering questions in my semester. No, that may happen really late and you might be due already for your assessment or even few assessments at the same time. So do your own research, but then when you go to the class, just do some notes. If the teacher will touch bases on some aspects, you know, covering your questions, you can actually add that information into your assessment. So if you start earlier, you will have this block of time until the due date to do your own research and also collect some information from the class. And also you can ask your teacher whether she can guide you in the right direction if you have certain questions and stuff like that. Then your quizzes. Usually quizzes are online on your TAFE Connect. This is like a database for all the students and teachers to access, and you will have all your quizzes in there. They are open book quizzes. There will be allocated dates for it and also duration of time as well. They're not that hard really. If you do all your readings, it's quite easy, and they will tell you how many questions you will need to answer to get the positive score. Then your lab tests. This is your practical tests. So first I will tell you what labs are. Labs are, it's a 3-hour session in actual lab. So lab is like a room in a hospital. It's exactly looking the same as it would be in real life. It has about 6 or 8 beds. Each bed has a patient. Patient is a mannequin, and it has all the real equipment inside that room. So you pretty much practicing in that room all your skills and all the theory that you went through in a class, you put into practice in that lab session. So you will have labs once a week, and the session duration is 3 hours straight. Okay, so during those labs you will have a practical tests. Your teacher will have a book for each student with the tasks and its description written in there, and then once you performed a task, the teacher will need to sign you off. So basically whatever you learn in a class in theory part, you will be practicing in your labs and then assessed for it. In order to attend your placements, you will need to be assessed on all of these tasks and signed off by your teacher, because this will prepare you for practical knowledge and skills once you go to the real world and treat real people, basically. Of course, this will happen under supervision of your RN. Okay, so then OSCA exam. OSCA exam, it's a 2-part exam. First part is your practical one, which you will be assessed in labs. You will be given a scenario, and your teacher is going to be your patient and she's going to be your assessor. So while you're performing your assessments on her and cares and all the other things that you need to do, she will be watching you, she will be assessing you, and she will be acting like a patient as well. So yeah, I remember my OSCA, that was fun. So that was the practical part. Second part is going to be in a different room. It's just a normal class. You will be taken there, you will be given a sheet of paper with the questions, and you will need to answer those questions by writing and then give it back to your teacher. So you will need to pass your OSCA as well in order to go to your placement and in general to finish your course as well. Okay, your next exam is going to be only once, and it's going to be medication calculation exam, and it's going to be performed during your semester 2. So this medication calculation exam is going to be after your first introduction into medication administration and following all the precautions and safety procedures and stuff like that. And mainly this test is going to be done on a computer. You will be given, I think it will be like 17 or 20 questions regarding your IM injection calculations, also for your subcards, also for your IV infusions, also for children dosages and stuff like this, also for oral medication, tablets and stuff like that. So you will need to pass this exam with 100% accuracy, because there is no one chance for mistake. Administration of medication is very important in real world. If you do an error, you might kill someone. So this is why it's very, very important for the nurses to know the right formulas, to know the right calculations and stuff like that, so they won't make mistakes. Okay, so yes, so you will have this exam during your semester 2. Also, before that exam starts, they will give you a chance to actually go online. I think it's iLearn website called, and you can there practice similar questions to what you will have in your exam, so that you can prepare yourself and just remind yourself the formulas and stuff like that. Okay, next I want to talk about what you will be actually performing in labs. So as I mentioned before, whatever you learn in your class, you will be practicing in your labs, because you will have labs every week of your semester. So some of the things that you will be practicing in labs will be, for example, wound management. So you will be practicing using different dressing types. You will be practicing removing staplers and sutures. All of that will be done on a piece of foam or on a mannequin. You will be practicing your aseptic technique when doing dressing change and using dressing kits and stuff like that. So this was one of the probably most exciting a practical part of my labs because I love dressing, I love wound management in general, so I'm sure you will enjoy that as well. Next, you will be practicing how to remove IDC. You will be practicing nasogastric tube as well. You will be practicing diabetes medication. That will include BGLs. This will include management of hypoglycemic and hyperglycemic episodes. This will include insulin administration as well. You will be also practicing different type of medication, oral medication for diabetic patients and its administration. You will have a chance to practice different type of injections using different type of needles. So you will learn how to do intramuscular injection, which sides of the body you do it to, so as subcut as well, and you will learn the size of the needle, the angle that you have to perform this procedure, and how deep the needle even goes and stuff like that. So you will be doing that either again on a sponge or on a mannequin that has like silicone parts on the body, specially prepared for practice of injections. Okay, you will also practice how to administer blood products, because you might face something like that during your placements. And also before placement, you will need to complete an online module. I think it's called Blood Safe, if I remember correctly, teaching you all the safety precautions and just knowledge in general about blood products. Then you will practice IV infusions, also BioRed techniques, push techniques, and so on, and you will be practicing different type of medication by doing these techniques. So when you go on a placement, for example, some of the hospitals do not allow EN students to even touch IV pump, but for example, in my own experience, I had the chance to do it under supervision of my RN, and that was in a private hospital, whereas in a public hospital you won't be able even to prime the line. You can't do that, but in a private they can allow you to do it under supervision. But again, this was my own experience. Each hospital is different, and you will be told by your facilitator on the introduction day what you can and what you can't do. And then you will be reminded, obviously, by your RN buddy as well. Also, for cardiac patients, you will be practicing in labs use of ECG machine. So you will learn where to put the nodules on the body of the person who has, for example, some cardiac problems. You will learn how to read a simple ECG print, which is your abnormal or normal rhythm. So this is like the basic knowledge that most of the nurses need to know, and then obviously you can give all this materials to the doctor after all the tests are finished. You will learn how to administer GTN, how to do the pain assessment, and also some blood tests as well. So I remember cardiac scenarios were one of the most interesting ones, because this is something that you will observe in hospital quite frequently, and you will be witnessing this, and you will need to assess your body RN with the knowledge and skills that you will learn in your labs. Okay. Also, you will practice management of tracheostomy and also suctioning, but the scope of practice for EN and RN is different in terms of tracheostomy case. So you will be only learn what will EN do in its scope of practice. Then you will cover also stoma and colonoscopy bag management as well. Then you will also cover stoma and colostomy bag management as well, and I'm sure you probably faced this if you already went on your first placement to HK during your first semester. I'm sure you had a chance to practice, or at least watch your carer or EN who would be performing management of these two bags. Also very important, on each or pretty much every session in your labs, you will be performing practice of giving handover and receiving handover. Why it is very important is that because when you go on your placement, each shift starts with giving handover by the staff who is finishing the shift, and then when you finish your shift, you will be given this handover of what you've done during your shift to your next staff. So you will need to learn how to receive it in the beginning of your shift and how to give yourself in the end of your shift. And in labs, we were practicing like a real handover sheet with the history of each patient, why the patient is in a hospital, what medication patient is on, if there is any scheduled tests or x-ray and stuff like this, if there is a discharge date and stuff like this, if there is any devices in situ, and so on and so forth. So it's basically very similar to the real world, and you will be given chance to practice giving handover and receiving, and then upon that, if you received a handover, you will be performing your assessments, following the care plan during your labs, and looking after that patient. So you might be allocated one scenario or one patient per 2 students, and you will be practicing during that lab session. So yeah, it's really fun. Like, if you have passion for nursing and you're doing this course because you love this profession and you're expecting to like it even more once you get to the real world, you will definitely enjoy all of these practical assessments and tasks that you will be doing in labs. Okay, so next, after handover, you will be learning how to create a care plan for the patient and how to follow already existing ones once you've got the patient from another nurse. So this is very important as well, and this is very common practice when you will be doing your placement. You will be faced with care plans pretty much on every shift. Okay guys, so now I wanted to show you how your lab books would look like. So you will have every semester a book given like this for your lab practice. So in this book, it's quite big actually. You will have scenarios, you will have tests, you will have description of certain topics, you will have forms to fill in and stuff like this, you will have your handovers. So what you will be doing during your semester as well, you will be following these books to fill in the missing information. You will be completing charts, like for example your observation for vital signs chart, or for insulin administration or oral medication administration and stuff like that when you practice in lab. And also each week of your studies will have its topic here in this book that you will be following strictly on every of your lab session. So you will have 3 of these books for each semester. Basically, you don't have to be signed off in these books. This is just for you, for your own use, and you're required to bring it every time for your lab session. Okay, now before you go actually to your placements, you will need to create something like this. So this is like just a folder with files inside, and this folder will contain all the documentations that your facilitator at TAFE will tell you to prepare prior to your placement. This will include your police check, this will include your form for the blue card, this will include all your immunization evidence, this will include also your online certificates for completing modules, because certain hospitals will tell you that you will need to complete online modules, and they will tell you how to access those modules and what those modules are. So you will need to do that, and then once you finish that, you will need to print out a certificate, and you will need to put the certificate in this folder. Also, you will have here your CPR and first aid certificates as well. And yeah, this is pretty much it, and also your blood safe module as well. So you will need to take this book on your first day when you start your placement, because you will have sort of like an introduction or a pre-brief session with your facilitator at hospital, and she will, or he will need to check this folder. So that was for that. Also about facilitators. So in my experience, I had facilitators with me during placements who were allocated by the agency, and those who were actually employed by the hospital where I was practicing. So you will have either both of those, and either one of those, and They are all great. Whether the person is working in a hospital or whether the person was assigned by an agency, they will be always there for you to support you and also answer all your questions. Also, they will be there to assess you at some point as well. They just want to make sure that you following the correct procedures, you're following safety precautions, and that you understand basically what you're doing. So this is very comfortable to have a facilitator who would see you every day. And I remember, if you have, for example, 3 weeks of placement, you will meet once every week as a group of students who is basically allocated in that particular hospital for a small, like a group debrief or pre-brief, whatever you call it, where you can discuss all your concerns, you can discuss things that maybe you didn't understand during certain situation of your placement and stuff like that, and your facilitator can put a little bit of light on those situations and explain to you so you could have a fair understanding, so that you will remember things correctly for your future practice once you become registered, once you become enrolled nurse. Okay, so next I wanted to talk about is that how long are you going to be your placements. So for semester 2, your placement is going to be 3 weeks. It's 3 full weeks of placement. You will be asked to do AM and PM shifts, no nights. Okay, well, at least in my campus, none of the students in my class had night shifts, but you will be allocated during weekends. Okay, so you might even have 6 shifts in a row and then have 1 or 2 days break and then have another 6 or 5 or 4. So each student is going to be different. Also, your shifts are going to be 8 hours length. So it's not really like 10 hours or 12 hours, something like this. It's just a standard 8 hours length of your shift. And you will have 2 breaks during those shifts. You will have 30 minutes your longest and then 20 minutes your shortest break at different times, obviously. You will usually go with your buddy nurse to have a break together. So that for the placements. For me personally, we had a choice for our semester 3 placement. So we're supposed to have, I remember, 4 weeks of placement as our final placement for last semester. And we've been given a choice to break it into 2 parts. So those people who would want to break it into 2 parts and take first 2 weeks and then leave another 2 weeks later would take 2 weeks in the beginning of the semester. I remember when I finished my placement for semester 2 in the end of the semester, I started my semester 3, and after 3 weeks I was due to start the first part of my placement. So soon it was. And I remember I had lectures, I had labs, I had assessments going on at that time. But I decided to take that opportunity and break my last placement into 2 halves so that it wouldn't be too hard for me physically in the end of my semester to complete almost a month of ongoing placement. Okay, also we were given choice to choose whether you want to perform your whether you want to do your placement in mental health facilities or you want to go to normal wards to hospitals. Those students who were more interested in mental health and maybe saw themselves working in this field after completing this diploma have chosen mental health placement. Those students who were not interested in mental health chose just normal hospitals. So I didn't choose mental health. I'm more interested in clinical skills and stuff like that in other wards in hospitals. So I went to a public and private hospital for my placement. Okay, for your pre-brief and debrief, as with semester 1 placement, your facilitator at TAFE, this is a facilitator that doesn't go with you to any placements. This is just the person responsible at TAFE campus, making sure that you have all documentation ready, making sure that you are all right on a placement. If you have any questions, you can call your TAFE and you can speak to her or him and discuss all these concerns. So that person is also responsible for providing for you pre-brief before you go on your placement, and then debrief once you completed your placement and you've returned back to the campus. So you will be held 2 of these before your placement starts and finish. Okay, also when you go on a placement you will have a logbook, and I think I mentioned this probably in my first video for semester 1. So it's pretty much the same book but with different tasks. So each semester you will have a book like that, but it will have tasks according to the subjects that you're learning in that semester. And while you doing your placement you will need to sign of those tasks. Usually it will be either your RN or EN signing your tasks once you perform them. For example, IM injection. Once you've done your IM injection, your EN or RN who witnessed you doing this can sign you off on a book. Or if you've forgotten, for example, sign it off and you can't anymore chase that EN or RN, you can speak to a facilitator who is with you on a placement and she can sign it for you, but you will need to show somehow of a proof. Okay, so this is why I advise to you always have your book in the nursing station for each of your shift, so that you won't forget to sign your tasks, because sometimes some of them ENs and RNs are hired there by the agency, they are casual and you might not see them again. Okay, so just keep that in mind. Okay, so also this book has a part where you have a journal, like a reflection journal, where you ask to write your reflection, your feelings, your thoughts, your expressions and experience of what's been happening during your placement. You can be quite open and honest there, but just like make sure yeah, just keep it like not too personal, I guess. So for example, if you had a positive experience with, let's say, communicating with one of your colleagues on a certain topic, you can discuss that and write your positive experience. If you had a little bit of negative experience, you can write that as well, but just be careful how you use your words, how you choose the words as well and stuff like that, because these books will be taken back to your TAFE campus and it will be handed to APRA, which is where you're going to get your registration. So just be careful what you write. Also, it will have in the end your attendance sheet, okay, showing the date that you visited your placement and also time of your shift as well. What else? Oh yes, also that book will have your standards for practice, so you will need to provide one example for each standard that you faced during your placement as well. So it's not really hard, it's all quite easy stuff. Okay, I would suggest to you never leave your journal and standards till the last day, because you might forget what you actually done during your placement. So once the opportunity came along and you know you've completed something that is asked for you to do in your book, write it down the same evening or morning or whatever shift you are on. Just write it down that day so you won't forget it. It will be easier for you in the end. Okay, when you go on a placement, you will need to follow a dress code. So I think I have one of the videos where I'm showing you what I'm wearing when I go on my placement. So I'll try to leave a link to that so you could actually see with your eyes how I look like when I go on my placement. So basically you will be told by your TAFE facilitator what they want you to wear. Basically this is your polo t-shirt with the logo of your TAFE. Then you will have black pants and black shoes. It has to be closed shoes just in case if the needle drops and stuff like that, so it won't penetrate your skin. Then you will have your ID card, which is your student ID card from TAFE, and I usually put my watch as well so I could access time easily. Your hair has to be tied, no long nails, no you know, like paint and stuff on your nails as well. What else? No bright makeup and things like that. So you will be told about all of that at TAFE. What I wanted to advise you when you go on your placement in terms of remembering medication, because I know it's going to be really hard for you to remember all the medication, and you will never remember that unless you worked in a field for quite some time, and with practice some of the medication will start to actually stay in your memory, and you will know what this one is for, what's the side effects of this medication, how to mix it with another one, and all the other things. So while you're learning, you can take something like this. I have a pocket notebook. This one is not an index book, because I was looking for index book in office work, and I found that each letter had like only 2 to 3 pages, which is not enough for me to, let's say, write down a medication starting with that particular letter. So I've bought just a normal plain pocket book or notebook, and I've put the stickers with the letters to the pages, leaving about 6 or 7 pages for each letter. Okay, what I write inside is a name of the medication, its class, route of administration, what it is used for, and side effects or adverse effects. And I do this for each medication. Okay, this is very handy, because if you scribbled some of the medication on a small piece of paper because you couldn't access it, you know, in your pocket, and you couldn't do it because you were too busy, whatever reason it is, on your lunch break you can sit down, or even at home once you finish your shift, and you can actually write down all the medication that you've written on a piece of paper, Google them up, and put all the description here. And the next time, even while you're actually writing it, it somehow help you to remember, because you're writing it down again. It's better than just, you know, like write it once on a paper and then discard the paper and forget about it. So you rewriting it again, and you're trying to remember it better. Then if you need to access it during your for example, placement, it's very easily accessible. Yes, you might access, of course, Harvard's or MIMS in drug room, but if, let's say, you're administering medication from the drawer of the patient beside the patient's bedside, and your nurse just decided to check your knowledge, and will say, oh, okay, so what is metformin for? Why are we administering it to this patient? If you forgot what it is, it's better not to say, oh, I don't know, or I forgot, or something like this. You could say, hold on a second, I maybe can't remember at the moment, but I've written it in my handy notebook that I carry with me all the time to remember myself. So you take it out of your pocket, you quickly looked at the letter M, you found metformin there, and you know that this is the medication for diabetic patient. Nurse will love you for that, because she will see that you've done your homework, even if it didn't happen today, but you've been collecting medications into your small pocketbook, and she sees that you're doing a hard work to actually trying to remember them, even if you can't remember it on the spot. You might be worrying, you know, like, can you imagine you're a student, someone asks like, do you know what this medication for? You're like, oh, I forgot, I can't remember. And this happens quite often. So at least you can show that you've been working hard to collect this information, and if you need to access it quickly, you have a place to access it. What else I wanted to talk about? So when you will be studying, you will have books in the library available for you to take home, and also available for you to access in the library. Those books that in small numbers will be most likely accessible only in the library, and you will have like certain amount of hours that you can borrow it for, and then bring it back again. We have library as well. In the library we have section with the computer tables, and also conference rooms if you want to do like a student group meeting and stuff like that. So yeah, you can use all of that pretty much for free. I wouldn't say that we had a lot of books available, to be honest, like a last editions and stuff, but we had editions that were no longer than 5 or 7 years old, which could be used for assessments as well. Also on TAFE Connect, on student platform, you will have a section for learning resources where you can access resources for each subject. Okay, you will have PowerPoints in there, you will have websites, you will have different sorts of links and videos as well. So you can access all of that to help you to basically cover some of the areas in your assessments, although you won't be able to reference TAFE, because pretty much all the hard work is done for you there by teachers. So you will be recommended to use peer-reviewed journal articles. You will need to be using official nursing books and stuff like this, pathophysiology books and things like that. Or for example, Clinical Key. Clinical Key is a great database, I think I mentioned that before, for nursing professionals and health professionals in general, doctors as well, where you can access latest editions of some books and also journal articles, and that subscription for Clinical Key will be included into your course. Okay, so yeah, so this is it pretty much regarding information sources for studying. You will need to be re-enrolled for each semester of your studies. I don't know why it's like this, but yeah, you know that you have, for example, 18 months of full length of your course, but yet they will ask you each semester, in the end of the last semester, beginning of the next one, to re-enroll to the next semester. So you can either do it online, or you can go to the support service office in your campus, and you can do it face-to-face with the person. So this is it pretty much. If you have any questions, okay, you can ask them in the comment section below. You're probably all thinking, does semester 2 and 3 get any easier? No, it doesn't. In fact, I'll tell you that semester 2 is the hardest one. I remember our teachers told us that if you survive semester 2, you're fine after that. But I remember when semester 2 finished, third one was hard as well. Not as hard as semester 2 though, but it was full on. Like literally full on. Maybe also because I broke my placement into 2 halves and I was doing so many things at the same time. But yeah, in general, like, it's all good. If you have any difficulties with your assessments, your teacher can help you. You can always contact them. You can always contact your students in a group and do some group work if you're not sure if you can perform certain, you know, researches or find information for your assessments. Like, everyone really helpful. Okay, just make sure that you not copy someone else's work. Obviously, just somebody can give you hints, for example, but you have to do the rest by yourself. Okay, but in general, like, Diploma of Enrolled Nursing, it is hard, but it is possible to complete for everyone. Especially when you have passion to this industry, you will be driven by that passion and you will complete the whole diploma. Doesn't matter even how hard it is. If you love what you're doing, you will overcome all these obstacles. Also, I wanted to mention in the end, before I say goodbye, that you will need to dedicate a lot of time to your full-time Diploma of Enrolled Nursing. It takes a lot of time. So if you thought that you were watching movies before and TV series and hanging out with your friends that often, is not gonna be the same once you start your diploma. Okay, especially on a full-time, a lot of your personal time with your friends and fun will be cut down to minimum. Not completely, of course, but will be cut down to minimum, because you will need to dedicate a lot of time to research. Okay, and just reading and educating yourself, because on the top of assessments and research that it requires, you also will need to read your learning materials on TAFE and in books as well. So this is it pretty much. Okay, the price at the moment for the whole Diploma of Nursing is 21,600, I think, unless they've changed it. Okay, but it does change every year. It depends. If you took a subsidized, for example, payment, you will be paying less, but all of that information can be accessed on a TAFE website once you put in a search Diploma of Enrolled Nursing. Also, I will leave a link to the description of the video. I will leave a link in the description box to the video of how you can start your Diploma of Nursing, what are all the requirements and stuff like that. I spoke about all the possible details that I could remember and come up with to share with you what I went through, about including costs and times and books and all of these things in that video, so I'll leave the link to that as well. For now, thank you for watching this video. Again, if you have any questions, please leave them in the description box below. If you're starting your Diploma of Enrolled nursing in the nearest year. I wish you all the best. I wish you good luck. I know you can do it and you will enjoy it. Okay, I'll see you then. Bye.